Hello, my name is Jim Simon, and I'm a licensed independent clinical social worker in the state of Rhode Island. I'm the Senior Director of Deaf and Hard of Hearing Services at Perspectives Corporation, and I'm also an outpatient therapist in private practice.
Hello, my name is Danielle Loughlin. This is my sign name. I'm a clinical social worker, LICSW. I've been working for about 12 years. I currently work at Perspectives Corporation. It's an agency in Rhode Island that provides services to a variety of deaf and hard of hearing individuals. I am currently the Director of Intakes and Admissions and continue to provide direct clinical services to early intervention, children's services, and outpatient counseling. Perspectives provides a broad range of services. Our deaf and hard of hearing program truly provides services from birth to end of life. We provide early intervention services by contracting with other agencies throughout the state of Rhode Island, and this allows us to service families that may have a deaf child or deaf parents. We have home-based therapy services provided to children with serious healthcare needs or those in need of behavioral supports. We can go into the home and work with families that have those needs. We have PASS service for children that need practice accessing the community, and we can help them develop the skills needed in order to succeed.
In addition to our specialized children's services, Perspectives provides day, community-based, employment, and residential services for deaf and hard of hearing adults with intellectual disabilities and mental health needs.
I want to provide basic information about mental health care for the deaf. In the United States, 1 out of 8 people have some kind of hearing loss. This includes people who are born profoundly deaf or those who develop mild hearing loss later in life, and everyone in between this wide range. Currently, the NAD states the mental health care system for the deaf and hard of hearing is inadequate at this time. Many mental health providers make errors related to cultural misunderstandings, language, and communication issues, and this can lead to diagnosis of mental health issues, disabilities, intellectual disabilities that are not correct. This has been noted many times. The NAD, National Association of the Deaf, has many resources that share information on how to better provide services to the deaf and hard of hearing in mental health settings. The biggest reason behind the inadequacy of this system is access. This specifically looks like communication. There is a small minority of providers who feel comfortable interacting with the deaf community, know how to properly request interpreters, and know about deaf culture. This number is very low. Also, among deaf people, there is a small percent that are fluent communicators in sign language. The number of providers that can adequately provide services is too small to meet the needs of the deaf community. Some providers are not aware of their responsibility under the ADA to provide interpreters, and when they see the cost of this service, they may try to avoid the expense. Another reason is that many deaf people don't trust the healthcare system. For many years, the deaf community has been oppressed and discriminated against by the public who can hear. They often don't believe that the healthcare system will help them because in the past, they have not been helpful. There can be an unwillingness to receive care from hearing providers. They can tend to avoid getting what they need because they don't think they will actually get what they need. Regarding the kinds of care needed, statistically, mental health issues are not more prevalent in the deaf community than the general population. They are relatively the same in that respect. If you look at the statistics of those in the deaf community that do have mental illness, it tends to be things like substance abuse, alcohol or drug use, adjustment disorders, depression, dealing with stressful situations that can lead to breakdowns, trauma. Deaf people are very vulnerable to abuse and have lived through a history of traumatic experiences, oppression, and discrimination. We do see a high number of personality disorders. However, when you look deeper, there are questions about proper assessments and misunderstandings that have led to many misdiagnoses. Many providers do not understand the norms of deaf culture, deaf language, and deaf ways of thinking. These cultural differences can be misunderstood and labeled as personality disorders. All of this means that we really need to have clinicians who can provide culturally appropriate care, whether they are deaf or hearing. Training and background knowledge needs to be provided in order to have the best and most appropriate care available.
Ideally, mental health professionals able to provide direct communication in the patient's language and in a mode of communication that is accessible is almost always preferred. It is also essential that deaf and hard of hearing individuals have access to mental health professionals who are familiar with deaf culture. That being said, there are very few providers in Rhode Island who are able to do so. And this reflects the nationwide trend that the National Association of the Deaf identifies as an acute shortage of qualified mental health professionals fluent in ASL. One positive change in the past year is that telehealth services are more widely available since the start of COVID-19, and insurance companies have loosened the restrictions that were once present where this service was not widely available or not easily reimbursed. Telehealth on a HIPAA-compliant platform allows for more individuals to access therapeutic services with a ASL first language or bilingual clinician from their home and solve some of the problems of distance or lack of transportation that may have been a barrier to treatment. Often the mental health care provider may need to provide the services of a qualified interpreter or have other accommodations for effective communication. The use of appropriate accommodations is essential for accurate and sensitive communication between the patient and the mental health professional. The answers to what type of accommodations are needed or are appropriate should always start with asking the patient. Never assume to know what is right without including the patient, as everyone is different, and there isn't a one-size-fits-all approach when it comes to accessibility. I also recommend a flexible approach, as you may find that what made sense for the first appointment doesn't always make sense for follow-up sessions. Checking in with a patient regularly on the effectiveness of the accommodations in place is strongly recommended to ensure clear and effective communication. A good example of this may be the addition of an ASL interpreter when a family member or partner is included in a session, as there could be a range of ASL skills demonstrated by all participants. Another example could be in deciding where participants sit in the office space in relation to the patient to maximize sight lines and minimize background noise that could provide interference. In the event that the clinician and the patient require support from an ASL interpreter in a therapy session, there are a few things to keep in mind. The National Association of the Deaf supports the use of qualified interpreters who have received specialized mental health training. This is useful language to have when requesting an interpreter through the Rhode Island Commission on the Deaf and Hard of Hearing, Interpreter and CART Referral Service. Again, involving the patient in gathering information about interpreter preference is important. The patient may have had successful experiences with certain interpreters in the past, or may indicate that they would prefer a deaf interpreter, for example. In some cases, the use of a video remote interpreter may even be preferred, but this can also present challenges and is generally less preferred over in-person interpreting. Using a family member, partner, or especially the child of the deaf patient is never advised. Who pays for the cost of an interpreter is a common question. Let me start by saying it is never the patient. Most health insurance companies reimburse providers for interpretation services. This can happen a few different ways, so it is important to consult with representatives from the insurance company and be clear on the steps for reimbursement. The interpreter referral service with the Rhode Island Commission for the Deaf and Hard of Hearing is also a great resource for gaining a better understanding of this process. For more information on mental health services and position statements with the National Association of the Deaf, visit nad.org. The Hearing Loss Association of America also provides great resources for patients and providers on their website and advocates for a communication access plan to be included in the patient's record. Visit hearingloss.org and look for the Guide for Effective Communication in Healthcare page.